What's going on? So today we're going to talk about airway equipment for intubation. Hope you guys like this video. Make sure you guys subscribe so you can see future ones. Like and comment. I'd like to see you guys feedback. So just a little bit about me. My name is Dee. I was an anesthesia tech for about a decade. Currently a respiratory therapy student. I've assisted in over 200 intubations. So I think I might have an idea as to how to intubate. And in this video, we're going to share with you guys just some equipment, some tips that you guys can check with intubation just to make sure you guys are prepared. Disclaimer, I am not a doctor. This is my personal experience in the field, just for information purposes only. Okay, so let's get into it. So why airway management is critical. We need to assess the patient to ensure that they have adequate oxygenation and ventilation. So intubation is a life-saving procedure in critical care, anesthesia, and trauma. The aim is to secure the airway to ensure the patient has proper oxygenation and ventilation. So usually what we check is the SpO2, which is a little probe that you put on the finger to see what the saturation is in the blood. The PaO2 as well tells you how hypoxemic the patient is, and the PaCO2 tells you if the patient is being ventilated properly or not. So the equipment readiness is crucial in intubations. In these settings, whether you're in the ED or you're doing a general surgery, whatever it is, you have to be prepared. So preparation equals better patient outcomes. So these are the indications for intubation. When do you intubate? When a patient has a GCS of less than 8, when the patient is cyanotic, unable to speak, obtunded, when the patient is hypoxic, when the patient is hypercapnic, has respiratory failure, for a surgical procedure like a general anesthesia, or the patient has a cardiac arrest. These are indications for intubation. The equipment for intubation. So usually, different people call it different names. So some people call it laryngoscope, others call it laryngoscope. Whichever floats your boat, you call it whatever you want, as long as you know what it looks like. You have different types. You have the Macintosh, Miller, and the Glide scope. Those are the 3 that we know of. There are other scopes out there, but they're used in specialized situations. You have something called a stylet, oral airway, ET tube, McGill forceps, manometer, back valve mask, anesthesia mask. Some people call it different names. Suction devices. You got the Yankar, the suction catheter. Obviously, you're going to need analgesia and relaxants and other equipment as needed. So before you intubate the patient, usually for a regular situation, you would do an assessment, which the doctor would do their assessment, and they would see how difficult the patient is to intubate for a normal circumstance. For example, a patient who is undergoing general anesthesia, the doctor will assess the patient, ask the patient to say they look into their mouths and assess. This assessment is done by giving them a score. So this will be the Malampati score. So if you are a good patient, you can see the uvula, the soft palate, they will give you a class 1. Okay, this one should be easy. This looks like an easy shot. If you're a difficult patient, you get a 4, a Malampati score of 4. So the soft palate, it's hard to see, it's not visible, the uvula is not visible, it looks like a difficult intubation. You need better preparation to intubate this patient, right? So you might need a bougie, a glide scope, something to help you with visualization, seeing the cords and the tube passing. So if the patient is stable, undergoing general anesthesia, as I said, the assessment will be done. The Malampati check will be done as well. So the whole team will know if this will be a difficult intubation or not. This is the laryngoscope. This one is called a curved tip here, as you guys can see, usually curved. You have a battery in here. Some scopes open at the top here. So you screw the top and you put the batteries in. Make sure the contact is there so you can get the light here. And it goes through the scope at the tip here. This goes into the patient's mouth. Okay, you have different sizes. So as you guys can see, you can use from pediatric way up to adult. So there are different size blades, size 5, 4, 3, etc. Okay, this is called a Miller blade. So as you guys can see here, the Miller, it's more a straight blade versus a curved blade. The Macintosh blade is curved, the Miller is a straight blade. Usually you see these blades used in pediatric cases. They utilize these blades. It helps with the pediatric ET tube, which is usually uncuffed and suitable for these scopes. Another device which is great in intubation emergency situations is a glide scope. You can visually see the cords on a screen, and it's usually done in emergency situation. You just use a glide scope here, you attach it to the device. So the scope is here, the device is here with this connection. Sometimes if this is disconnected or not placed in properly, you won't get the visual. So you have to make sure it's well connected. Put the scope in, you look here, and then you pass it through the cords. You take the stylet out, and then you inflate the bulb and start bagging your patient. So this is what the ET tube looks like. There are different types of ET tubes. These are for adult patients. This ET tube, the diameter is usually seen here. So where you see ID, it's 7.0. This is a size 7 ET tube, but this is a south-facing ET tube. Usually use these in situations like neuro, if the patient is being worked on the head, or you can utilize it in ENT, whichever situation. Usually in ENTs, either nasal pharyngeal tube or south-facing tube is used based on the surgeon's preference. This is a regular ET tube like this one, but as you guys can see, this stylet is more rigid than this one. This is a glide scope stylet. It usually stays like this. It comes with the device. This one you can use in any tube at all, but this is specifically for the glide scope. But as I said, guys, it all depends on where you are. Everybody has their own procedure. These are called oral airways. So usually this is used to prevent the patient's tongue from falling back and obstructing the airway. So you have different sizes. Usually it depends on the patient. If it's a bigger patient, you need a bigger oral airway. You have to use something like this. If it's a smaller patient or a neonatal, as you guys can see here, there are different sizes. So you assess your patient and you will select from whichever oral airway that suits the patient's needs. This is used in emergency situations or with quick surgeries. This is called a LMA, laryngeal mask airway. Laryngeal mask airway used in difficult situations. So, for example, you can't get an ET tube in and you need to intubate your patient as quickly as possible. This is a great tool to use. You just place it in and it sits in the patient where the patient trachea is here, and you just ventilate your patient from there. So you normally utilize in short surgeries, for example, orthopedic surgeries, maybe possibly an hour, short surgeries, in and out. This is a great device. So you would usually have your checklist as to what you would use to intubate your patient, right? This could be a checklist. You can have your own checklist specifically for your hospital, where you'd want a bag valve mask, a bag valve BVM device, a yanker suction, you want tape, lubricant, just in case it's difficult and you need some lubricant to pass the tube. You like an ET tube, oral airways, nasopharyngeal airways, laryngeal mask airway here, and obviously a laryngoscope. Those devices are extremely important. This device is called a bougie. The bougie is used in difficult intubations as well. So if it is that you can't get the tube and you don't want to use a LMA, a laryngeal mask airway, you can utilize a bougie. So you place a bougie with the laryngoscope. So you place the laryngoscope, open the airway, and then you pass the bougie through the cords. What you do next is pass the ET tube over the bougie and just guide it through the cords. As I said, usually utilized in difficult intubations. Another device, which is extremely important, is usually used in nasopharyngeal intubations to pass the nasopharyngeal ET tube from the nares to the vocal cords. So this is utilized to pass the ET tube through the vocal cords to ensure that you are in the vocal cords and not the esophagus. Another device is extremely important are suction devices. Why? You don't want the patient to aspirate and then now have an aspiration pneumonia. You don't want the patient to have bronchospasms. So secretions can cause bronchospasms, can cause problems with the airway. So you should always have suction devices. You can utilize a Yankauer, and you can also utilize a suction catheter. This can be used in the ET tube, and this will be used orally to suction the patient's secretions. That is all. Thank you guys for watching this video. I hope this was of some help to you guys. I look forward for your comments, like, share, subscribe, and I'll see you guys in the next video.